I'm Jeyahn Wood. I'm an assistant professor in plastic surgery. So I'm the only pediatric plastic surgeon at UNC, and I really treat children with an incredible variety of different issues, from extra digits, extra toes, fused fingers and toes, to kids with vascular anomalies like hemangiomas or venous malformations on the surgical side. We also have an amazing vascular anomalies team here at UNC, and so we can treat that from a multidisciplinary approach as well. In addition, I do reconstruction on kids that have abnormalities in their ears, if they're born without an ear or even just prominent ears. And then the more complex side of things, cleft care, but also craniosynostosis, where the sutures that are the openings between the skull bones, if they fuse early, they can lead to abnormal head shapes, which might be a problem for brain growth and development. And so I offer reconstruction for that as well, along with my pediatric neurosurgery colleagues. So what inspired me to become a doctor in the first place was really my mom. And growing up, she was an OB and well woman's nurse practitioner. And so I had quite a lot of experience with her, going to her clinic, seeing her how she interacts with her patients, seeing the kind of impact that she had on these women, and doing reproductive health on their families. And so that's really what inspired me to get into medicine, and she's the one that really inspired me to go to medical school. When I was in college, my grandfather underwent a pretty radical surgery that altered his facial appearance. And I got to witness firsthand how that really impacted his self-esteem, his self-confidence, and really his identity as a person. But then I got to see how a plastic surgeon tried to restore his appearance through a reconstructive surgery. And that was my first experience with plastic surgery. So then when I did a plastic surgery rotation, my third year of medical school, I was able to rotate with the pediatric plastic surgeon and was really amazed by the before and afters on babies specifically with cleft lips and cleft palates. And seeing that kind of an impact in the bond that he had created with those families, I thought that was really special. A baby is born with a cleft. That's a pretty overt physical difference, and it can be quite emotionally straining and overwhelming for families, especially if the cleft was not prenatally diagnosed. So for me, it is incredibly and deeply satisfying and gratifying to be able to have the skill set to restore form and function for these babies. By repairing a cleft lip, the baby is then able to smile fully. They're able to eat more efficiently. By reconstructing a cleft palate, they also can eat better, but also then have the ability to form certain sounds that will hopefully contribute to intelligible speech as they grow and develop. So I really love to have prenatal referrals for patients that have a prenatal diagnosis of fetal cleft lip and or palate. I think it really gives us an opportunity to offer reassurance to those families who can be really overwhelmed. Oftentimes it's their first baby, which can be overwhelming enough. And so we like to talk to them really about what to expect primarily in the first year of life, and talk to them about how important it is for feeding, getting the baby on the right specialty infant feeder, especially if they have a cleft palate. And then we also talk to them about our UNC craniofacial team, which is housed at our dental school. And it's a team of multidisciplinary specialists, and we follow those kids throughout their entire childhood into adulthood. And we even offer an adult cleft clinic now. So we can really treat these patients that have lifelong needs throughout their lives. I really treat my patients like my own kids, and I do treat my families like they're my own family. And I think that gives me a certain element of kind of connecting with my patients in a different way. I really value the bond that is created between my patients, their families, and with myself. And I consider it the greatest privilege to be chosen by a family to be their child's cleft surgeon. And hopefully that will give me the opportunity to follow that child through adolescence, and be able to provide them with any clinical care, but also emotional support that they might need as they enter through adulthood.